Start.
This is a case of multiple lipoma. You can see many swelling in his arm. Many people have this concern when they have these swelling, these lipomas, because they are not taking good diet. They have some mistakes in the food, because of that this happens. You can see this man is a bodybuilder. You can see every muscle, and there is no amount of fat in his body. You can see there is no subcutaneous fat. There is direct muscles under it. So one myth should be very clear, that lipomas are not related to your diet. Okay. Second thing, lipomas are mostly hereditary. Even this patient has a history of in a family of lipoma, but many times this hereditary factor cannot be traced in all patients. So almost 80 to 90% we can identify. In 10 to 20% we are not able to identify the family history. So patient then try different type of treatments. He has also tried different treatments. He had tried medicines, different type of medicines. He has also done the surgery. But you can see this surgery which he has done. These are the type of scars which he got because of the previous surgery for the lipoma. When somebody is getting this type of scar, then he will never think of removing these lipomas, because everywhere where he has this type of scars, it will be very difficult for. It's better to have lipoma rather than getting it removed with this type of scars. So this patient, because of this scar, he has a history that he was getting married, and when they noticed this, and then they noticed the multiple swellings, and his marriage got cancelled also because of this lipoma problem. So he's traveling from very far just for the removal of this lipoma. He has tried, when he was getting this lipoma removed, he was promised that he will get negligible scar or no scars, but this is one scar. These are the other scars. Of his previous lipoma surgery.
This one also.
And but these were the worst, which were actually very much problematic for him. He had done the surgery on the other arm also. So this time he has come for the removal of many lipomas. He has lipoma on abdomen and back also. These are also we will be removing. So the process is removing these lipomas. Either we should remove them or we can leave them as such. If they are not very prominent, if they are not affecting the quality of your life, you can live with them. But the way his lipomas are, so many lipomas, and especially he is a bodybuilder, whenever he is going to the gym, this type of lipomas, when they are visible under this, so he feel bumpy arms. He's not liking that, and everyone notice it, and just definitely it is his social life is also getting affected because of this. So we will try to do with our technique of minimal scarring technique. One of his friends got it done, and then he sent him for because when he see the results, he is coming further. And many times patients come again and again. They not have a good budget. They cannot remove all of them in one go. Sometimes they just remove forearm. Sometimes they remove arm lipomas. Normally we avoid the abdomen and back lipomas. But when it is, if they do not have any major concerns with the budget or something, then they can consider removing them also. But primarily forearm is most important thing where we must think of removing, because these are not just lipomas which are bothering. This is affecting his self-esteem. These are affecting his social life, and many times we have seen there is discrimination in the job also because of this. Sometimes in interviews they get rejected if these big lipomas are noticed in the medical, although they are not a medical disease, but many times they are rejected because of this. Thank you.